Guys, so today I'm going to tell you a little bit about Tucker's birth story, part 2, and his jaw distraction surgery. So if you haven't watched the first part of his birth story, I'll link it in the description below so you can check that out. So when Tucker was born, probably about a month and a half after he was born, we went to see a cleft clinic specialist. Though he doesn't have clefts, he does have PRS. Within the first maybe 2 minutes, the doctor said, yes, he's going to have a jaw distraction surgery. So the first thing that they did was we went to had a sleep study done. And with the sleep study, they determined that he had obstructive sleep apnea, which is different than just, obstructive means that there was something in his airway, which is most likely his tongue was falling back into his airway. Which is different than sleep apnea. Sleep apnea is basically where your brain is not telling your body to breathe. And this is something that was in his airway. So that was happening 18 times an hour per night that he was basically stopping breathing. So that's pretty scary. So then the next thing that they wanted to do was a CAT scan, and it basically determined that yes, he had a small jaw and he needs the surgery. So we waited, for a couple of months, and sometimes they wait for it to naturally grow, but there are two reasons they do the jaw distraction surgery. Is one for breathing and one for eating. Well, Tucker was 100% on a G-tube, and his breathing wasn't good either at night, and sometimes not even during the day. So, but we did have to wait until he was about 7 months old, just because we were trying to get insurance to get that approved and all of that. So when he was 7 months old, we went to have the surgery. It was that night. I did not sleep the night before. I remember just tossing and turning all night. Of course, that's to be expected. And then we went to the hospital, and I was so thankful that we had family and we had friends there that were there to support us. Of course, this was pre-COVID. Now they won't let you do that, but we had lots of support. And then he got out of surgery, and it was definitely a stressful time. He was in a lot of pain. They put the T-pins here. The really long pins he had that for 2 weeks. We had to churn. And then after that, we got those taken out. And then after the 2 weeks, and then we had just the little pins, and as you can see in the picture, and then the little pins were there for about 2 months, and then we had that surgery. That surgery, as far as pain goes, that was a much easier surgery. It was much easier. A couple of tips that I have is, one, I would definitely recommend having a ENT versus a oral surgeon do the surgery. We had an oral surgeon, and as he did a great job as far as the surgery. Everyone says that his scars look great. The surgery went well. But the reason why I would suggest that is because I feel like you get a more whole body taken care of if you had an ENT versus the oral surgeon. So basically, when Tucker was in his second surgery, I'm not sure exactly what happened, but he started having some breathing issues, and the surgery was actually longer than the first one, and it was only supposed to be an hour, and I remember it was maybe 2.5 hours or something. I can't remember the exact time, but I know it was longer than the first surgery, and it was taking forever. And I was like, okay, I was starting to get stressed. And so then when they came in the recovery, I was like, man, why did it take so long? And they said something about they had to section him, and that he was having a trouble breathing. And then after that, I started noticing that he was breathing not good at all. I mean, he was just struggling to breathe, and his chest looked funny. It was bulging out. And so of course there was doctors there on hand, but they weren't familiar with Tucker, and they weren't familiar with the case. And then the surgeon, he just did the surgery. He wasn't, you know, necessarily even at the hospital. So I feel if we would have had an ENT, it would have just been a little bit better of an experience. So then after we left, we went to our hospital in our town, and he had pneumonia. So I just felt like he would have had a little bit better of an experience. And then my second tip is definitely make sure, especially during the first surgery, that you make sure you stay on top of those nurses to keep up with the medication. I did that, but I'm just, you know, I would just make sure like 30 minutes before time, set your alarm, go find a nurse, because it'll take them 30 minutes to get there, so that you can make sure to stay on top of the pain. The next tip I have is before you go to do the turning, I would make sure that you give some type of medication. They say that, you know, it doesn't necessarily hurt them, but towards the end, I mean, you're turning it 4 times a day. Tucker's was kind of pulling at his skin a little bit, and I feel like it definitely hurt him. So I would just make sure that you give him some type of medication beforehand, so that they're not in pain. I also be prepared for, especially during the first surgery, a lot of blood. That was one thing I wasn't really expecting. You might think I'm crazy, but I just wasn't expecting that much blood. So just be prepared for that. And then another thing is, I would make sure that you have a lot of family support, or definitely do some meal prepping, so that you don't have to worry about if you go home during that 2 weeks. I didn't do anything for 2 weeks. We didn't go anywhere. We didn't do anything. We stayed at home because, of course, we had to do the turning for 2 weeks. And I had meals ready. My family helped out with meals. But that was such a big help because for those 2 weeks, you're just doing your turning. I mean, that's basically, some hospitals have you stay in the hospital. Tips for the jaw distraction surgery, and you know, Tucker, he's doing great now. Can you say hi? Oh, good hi. Look at you go, Tucker.